Welcome to the latest episode of WellLink Policy Points. On July 4th, H.R. 1, also known as the One Big Beautiful Bill, was officially signed into law after a narrow passage in the House and Senate. The bill includes sweeping changes to Medicaid and other health programs and is expected to have a profound impact on hospitals and the health of our communities. The law cuts $186 billion in SNAP funding, which is projected to cost Ohio an additional $416 million a year. The Urban Institute projects that 717,000 families in Ohio will lose some or all of their SNAP benefit. The reductions to Medicaid are of significant concern. The federal spending package will lead to a $37 billion reduction in federal Medicaid funds in Ohio over the next decade. According to the analysis by Kaiser Family Foundation, Ohio could receive 14% less in federal dollars for Medicaid. The National Academy for State Health Policy found that the impact on state budgets will be felt most significantly by the 40 states that have expanded Medicaid. That includes Ohio. State leaders will need to make decisions on how to account for federal funding reductions, with limited options for new dollars to make up for any gaps. At WellLink Health Alliance, we will continue to advocate for our community needs. We are concerned about the rise in uninsured and financial sustainability of our healthcare system that could result in reduced access to care and threaten community well-being. The law is slated to reduce $340 billion out of the hospital budgets over the next decade. However, Congress delayed implementation of most of those cuts to 2028. So hospitals and healthcare providers are already gearing up to use the next 2.5 years to advocate for changes. It is likely that we'll see an end-of-the-year spending package emerge again this fall. Providers and advocates will continue to be engaged as legislative vehicles can be opportunities for additional payment cuts and provisions that jeopardize access to care. The federal law didn't cause provisions in the Ohio budget to go into effect that would have eliminated Medicaid expansion coverage if the federal match fell below 90%. Instead, congressional leadership found a different way to cut spending through work requirements. Starting in 2027, adult Medicaid patients under the age of 65 will need to prove they worked, volunteered, or attended school at least 80 hours per month. It is important to stay engaged as guidance regarding the implementation of these work requirements are forthcoming. The law also creates a $50 billion rural health grant program to support rural hospitals and providers, which serve more Medicaid patients and could be hit hardest by these cuts. A Kaiser Family Foundation analysis found Ohio could lose over $6 billion for rural areas over the next decade because of the Medicaid cuts. Hospitals and clinics are seeking to understand how to access the rural grant funds expected to be released by the end of the year. Attacks on Medicaid are not over. There is talk among some senators that there may yet be another chance to repeal an expansion of Medicaid offerings. Also looming is the expiration of the ACA enhanced subsidies at the end of the year, which helps low-income enrollees pay for their insurance premiums. This would result in a greater number of uninsured and increased financial volatility. Current attention is on the appropriations process to fund the government by October 1st, the start of the next fiscal year. The markup for the Health and Human Services programs has been pushed from July to September due to the August recess. With the clock ticking towards the September 30th deadline, there is increasing likelihood that Congress will have to pass another continuing resolution or face a government shutdown. One of the programs that WellLink is actively engaged with our policymakers on is supporting the Hospital Preparedness Program, which the President eliminated in his proposed budget. As Region 2 coordinator and convener of the Northeast Ohio Healthcare Coalition, we understand the vital support that hospital preparedness funding provides to ensure coordination, education, readiness, supplies, and communication. In addition, last week, the Senate passed a rescissions package that the President had to sign by July 18th. The rescission process allows Congress to cancel funds it previously appropriated, but that the federal government has not yet spent rendering those funds no longer available to departments and agencies. The rescissions bill makes $9 billion in cuts to international aid and public broadcasting. This is the first time in decades that a rescissions package has been approved. On the regulatory front, we are seeing changes in reimbursement as a result of the final rules for inpatient prospective payment, home health, physician fee schedule, and outpatient prospective payment. These reflect some increases and some decreases in payment, as well as renewed focus on value based payment models, seeking to reduce fraud, waste, and abuse. In addition, there is increased interest in the future of digital health. That includes AI, data operability, hospital at home programs, wearables, and extending the important telehealth flexibilities. Tune in to the July 10th City Club Forum on AI and Healthcare, where Brian Lane, CEO of WellLink, was joined by colleagues from Metro Health, Cleveland Clinic, and Health Literacy 360 and the Northeast Ohio AI Center of Excellence as they addressed ensuring trust in AI in healthcare. Stay tuned to future editions of WellLink Policy Points for more developments in this ever changing healthcare landscape.